So in this segment, let us now discuss about diabetes-related complications. Most of the common symptoms of diabetes which we all are aware of, like increased thirst, increased urination, weight loss, are actually seen in only a very small fraction of patients who have diabetes. In fact, these symptoms arise when the blood glucoses are extremely elevated. But for moderate degrees of increased blood glucose levels, most patients do not experience any symptoms at all. And this is primarily the reason that most of us tend to ignore diabetes, most of us tend to not follow up regularly with doctors, with physicians, and chase the targets. So the reason that we are chasing diabetes-related treatment targets which have been clearly laid down is primarily to prevent what are diabetes-related complications. So any degree of glucose elevation which is above the laid down targets increases the patient's long-term risk of getting organ defects. Now these organ defects are variable. Almost all major organs can be affected by uncontrolled diabetes. They include the heart, where uncontrolled diabetes can lead to cardiovascular events. It can lead to strokes. Uncontrolled diabetes can also lead to kidney defects, the long-term damage to retina leading to visual loss. You would be aware of nerve damages leading to numbness of hands and feet, which may progress to diabetic foot ulcers. Also, diabetes can lead to liver dysfunction in the form of fatty liver, which may actually progress to more severe forms of liver disease like cirrhosis. So, despite a large section of the patients with diabetes being asymptomatic, it is extremely important that regular glucose monitoring is done and treatment targets are followed. So treatment targets basically are to maintain a fasting glucose level between 80 and 130 milligrams per deciliter and up to a post-meal glucose level of less than 180 milligrams per deciliter. HbA1c targets in most patients are less than 7%. Of course, there would be certain specific categories like pregnancy, like elderly patients, where targets can be individualized. Hence, it is extremely important that one checks glucoses regularly at home, tests for HbA1c every quarter, and also combines this with an annual screening test to look for all diabetes-related complications. This also involves regular follow-up with your endocrinologist or physician for an appropriate treatment. Thank you.